Hi everyone, my name is Robin Ortega, and today I will be talking about weekly and monthly QC in the microbiology department. At the end of this presentation, microbiology staff will be able to uniformly prepare QC organisms from stock material, perform monthly QC, perform weekly QC on the AST Vitek 2 cards. This is a two-sided chart that is found in the microbiology department in the binder. This describes what organisms need to be set up on the first week. It also says what organisms need to be done on weeks 2, 3, and 4. Every 4 weeks, new bacterial organisms need to be grown from a pure source to prevent bacterial mutations. Bacterial mutations could alter expected QC results. We use 3 different types of stock organisms. We use culture loop, charcoal discs, and a quick stick QC. This is side 2 of the chart, which explains what we do for the following weeks 2, 3, and 4. This is a list of the organisms that are needed for the AST cards, which are QC'd weekly. We're going to start by removing 7 tryptic soy broth tubes from the refrigerator to warm to room temperature. We're also going to pull out 7 organisms that'll be from charcoal pellets, and we're going to warm these to room temperature along with 8 culture loops. Again, warming to room temperature before we do anything with them. We are going to label the tryptic soy broth with the name of the organisms, its number ID, and today's date. We are then going to take a pellet from the glass tube and put it into the tryptic soy broth. We're going to vortex for about 5 seconds, and then we're going to put the tryptic soy broth in the incubator for about an hour. We're going to pull it out of the incubator in about an hour. As you can see, it's starting to break up, but we're going to take it and we're going to vortex it for another 5 seconds to break it up even further and put it back into the incubator. We are then going to take a sterile pipette and aseptically take some sample from the well-mixed tryptic soy broth tube and put a drop onto the blood agar plate, and then we're going to streak as we would a regular culture where we have a primary and streak out from there. So now we're going to start with the culture loops. We're going to make sure everything's up to room temperature. Again, we're going to label with the name of the organism, the number, today's date, but we're also going to call this the mom plate. This mom plate will be used once a week to sub for the new week's growth for the QC and the Vitek 2. Culture loop, just kind of a little bit of organism between the middle. So we're going to take the loop and we're going to lay it flat across the blood agar plate. We're going to pull straight down to streak the plate, trying to get as much contact with the plate as we can with the loop. We're also going to take the loop and we're going to flip it over, and we're going to try to get as much growing as we can. This is really good growth for the next day. So then Strep pyogenes is good the way it is because that is not an organism on the Vitek 2. Your left-hand plate is an enterococcus, and that is one that is actually going to be put on the Vitek. So what it needs to happen is it needs to be subbed a second time. Alright, so this is the monthly list of QC. So this is all the things that need to be QC'd monthly in the microbiology department. This includes all of the manual testing, the kit testing, and it also includes the QC for the BACTEC, which is our blood culture analyzer. So this is the plate the second plate for the organism that we grew out. Like I mentioned earlier, we need to sub it a second day before we can put it on the Vitek 2. This is the home screen for the Vitek 2. What you're going to do is you're going to make your McFarland standard, and you're going to treat it just like you would a patient, and you're going to put it in the rack, and you're going to pipette over the appropriate amount into the second 3 ml tube, and you're going to load it onto the machine, and then we're going to come to the computer, and we're going to select the icon that looks like a rack with a bunch of cards in it. And when we select that, we will come to a screen like this, and we're going to select what cassette we're on, and then we're going to take and we're going to select the QC box in front. And when we select that QC box in front, we're going to come up with 2 options. We're either going to have options for the gram-negative, which is on your left side, which is 4 organisms, or the gram-positive card, which is going to show you 6 organisms. So you select your appropriate organism, you then put your initials in the corner box, and you save it so that the machine knows to run it. You're going to come back the following day, and we're going to go in and manage QC results. These QC results have already been looked at, so they're a full green box. When you look at them originally, they're a kind of a clear box with a green edge around them when they worked. So then we're going to come over and we're going to put in the comment section today's date, QC OK, the initials, your initials, and then you're going to hit the review button. You're going to hit this twice, and then it's going to ask if you want to print, and you're going to say no. This is a job for the lead tech. She goes in and checks the QC on a monthly basis.